it is a basic presentation. It is just that rickettsial diseases are not just scrub typhus. This is beyond scrub typhus. So I will be covering that briefly. So when you look at this busy looking slide, so you can well make out that how difficult my job is. So everything is spread all over the world, known by different names. There was no classification. Patient or disease from typhus group being leveled in the spotted fever group. Patient suffering from spotted fever group has been named as typhus group. So everything is jumbled up. So Rickettsia is a diverse collection of organisms. Of course, there are differences in between. So genus Rickettsia belongs to tribe Rickettsi, family Rickettsiaceae, and order Rickettsiales. So the general characteristic of Rickettsia is that in the life cycle there is involvement of a mammal and a arthropod. And these infections are maintained in nature through a cycle which involves a mammal reservoir and arthropod vector. So these are obligate intracellular bacteria, first described in 1909, and now genus Rickettsia comprises of 31 species and it's ever expanding. So now it has been classified broadly into typhus group. So the prototype is classical epidemic fever. And there are two organisms, Rickettsia provazekii and Rickettsia typhi. These are transmitted by human louse and rat flea, respectively. The other group is spotted fever group. So there are large number of organisms which has been clubbed together in this group. Rickettsia rickettsii is the main prototype described, and then Rickettsia conuri. So these are transmitted from rodents and other animal ticks. And Rocky Mountain spotted fever is, of course, most studied group. Third one is scrub typhus caused by Orientia, and it is transmitted by the larval form of the trombiculate mites. So there has been certain new or emerging rickettsiosis. One is Sanlat, scalp eschar neck lymphadenopathy. The old name of this was Tibola. And dermacetor-borne necrosis eschar lymphadenopathy, Dabonal. And these are related to Rickettsia slovaca. So lymphangitis associated rickettsiosis are related to Rickettsia severica. The Rickettsia brunoti was renamed as Coxelia brunoti and Bartonella species. These have recently been removed from the Rickettsia. But still in literature, many times we find that these are being described along with rickettsial infection. So the diseases caused by Rickettsia and Orientia are collectively referred as rickettsiosis. So rickettsiosis transmitted to human by arthropod. So because of the lack of the awareness and lack of the diagnostic tools, these remain undiagnosed, and public health impact of these diseases is unmeasured, but it is said to be large worldwide. So the infection can be acquired through different routes and depend upon the vector involved and rickettsial species involved. So most of spotted fever group rickettsia are harbored by exotic ticks, and these are transmitted during feeding. saliva. The most other rickettsial are harbored by mites. So flea and louse-borne rickettsia. This causes infection by entry of fecal material into bite site or cuts in host skin. The typhus group rickettsia also causes infection through aerosol inhalation also, and these contaminate the dust particle which float in the air. So the Aurencia species is transmitted by the trombiculate mite. So spotted fever group, so roughly 15 rickettsiosis are classified into it, and this is the group which is most expanding now. And this is tick and mite borne zoonosis, and these are closely related. So Rocky Mountain spotted fever, Bottomless fever, African tick typhus, North Asian tick typhus, Queensland tick typhus, Finlander Island spotted fever, Japanese spotted fever, rickettsial pox. These are the few to name in this group. The severity spectrum of this group is quite broad. So the Rocky Mountain spotted fever is said to be the most virulent. This rickettsia causing Rocky Mountain spotted fever, it is most researched. So it is found to be present all over world except Antarctica. Ticks of Dermacentaur, Typhus embryoma, these are the main vectors and the reservoir also. So these are transmitted to human during feeding. So this is just to show the rash of the Rocky Mountain spotted fever. This is another photograph showing that. So basic pathophysiology, though this applies to almost whole of the rickettsia, because these once into the body, this will disrupt the endothelial junctions and of the small to medium sized vessels. This is all the effects or complications are because of single most important pathophysiology. So there are subtle differences how these rickettsia spread within the body. So they invade the endothelial cell of the vasculature. Once inside, they damage the membrane, influx of water takes place, then these will escape from the cells. In spotted fever group, the spread is from one cell to cell. There is cell-to-cell spread. So again, the increased vascular permeability is the most important pathological effect, leading to edema, volume loss, hypovolemia, decreased osmotic pressure and hypotension. So they may lead to interstitial pneumonia, interstitial myocarditis, pericard, CNS infection, kidneys, GI tract, pancreas, liver, skeletal muscle and skull. So almost whole of the body is involved. So clinical manifestations, fever, myalgia and severe headache. So severe headache, if you go into the literature, it is said that this is probably the severest headache experienced by an individual is caused because of rickettsial infection. So the rash of spotted fever appears usually on 3rd to 5th day after fever, and overall 91% will have this. So rash typically appears around wrist and ankle, but rarely it can start as diffuse also. So focal neurological deficit, transit deafness, meningitis, photophobia, lead suggestive of meningitis or meningoencephalitis. The fulminant Rocky Mountain spotted fever is common in black individuals with G6PD deficiency. Older age, males with alcoholism are said to be associated with fatal outcome. The other group, there are 8 other spotted fever